Today is about the power of you. You will change the world.
Welcome to Turning Point with Patrice Williams.
We can be whatever we dream.
Enhance the way you think about successful entrepreneurship, empowerment, and politics to live your best life.
Fulfill the highest, truest expression of yourself.
And now your host, the authentic, impactful influencer and coalition builder, Patrice Williams.
Hello. This is Patrice Williams. Welcome to today's show. I have been waiting literally for this show since last month, knowing that vaccines were coming down the pike. And I am just so excited that we're going to have someone that we've all been wanting to meet. Dr. Christina Wu. I'm going to bring her on with no delay. Hello.
Hi, good morning. Thank you for having me. We've had a long morning trying to get online, huh?
I know you know what? Thank you for holding tight with us. We were having a little bit of technical issues and we just powered through them. I started to get texts saying, "Hey, when are you going live?" I think this is a show that everyone is waiting for. So I appreciate you. And so, but before we get started, I want the good people to know all about you. Please meet, I'm just opening up your bio here. Here you go. Please meet Dr. Christine Wu. She is the Deputy Health Officer and Chief of Communicable Disease Control for Solano County. She has been on the front lines of the COVID-19 pandemic response in Solano County since last January, including case investigation, contact tracing, outbreak response, and now with vaccine distribution. Dr. Wu practices in Solano County's primary care clinic and has a background in preventive medicine and general public health. And I have to tell you, Dr. Wu, when I read your bio last week, the first thing I thought was, she's been working on this since January of last year. And I don't think I don't know if we knew until March that this was happening. So you were frontline.
Yes.
How did you know? How did that happen?
So, it really was just about a year ago, almost to the date, that we started as a country, as a county, to begin our first efforts to learn about and prevent the spread of this new coronavirus from entering the United States. And I think you may recall February 1st, I believe, was when we started with the closing down the airports and travel restrictions. Well, the county was hard at work at that point, trying to prevent the virus from coming in. So yeah, it's been a long road, but the good thing to know is that, we've learned a lot about how this disease works, how it spreads, how we can protect ourselves. And now, with this very safe and highly effective vaccine that just got the emergency use authorization from the Federal Food and Drug Administration, we really do have a light at the end of this very long tunnel.
The other thing that came to mind when I read your bio was, your position, Communicable Diseases Chief. And so I was like, okay, is this a new position or were you hired for this moment?
No, I got lucky. Most people who work in public health don't get to work on a pandemic of this magnitude in their, this is a once in a lifetime kind of a experience, I should say. So, but communicable disease control is the bread and butter of public health. In fact, that's how public health came to be. We're here to protect the health of the community, especially, prevent the transmission of something, especially like a novel coronavirus, from hurting and killing people in the community. So that is what public health does.
Right. So just to remind the audience, I see we have a lot of people, a lot of viewers. There are viewers from all platforms: Facebook, YouTube, LinkedIn, and Twitter. And you can put your questions in the chat. And were you able to see Empower Solano welcome Dr. Christina Wu? Can you see the interactive chat? Or is
Are
it?
you asking? I can see the chat, yes.
Okay, perfect. So as questions come in, we'll be able to see them.
Oh, actually, I cannot see the chat. What I see is the link here. Yeah, I don't, because I'm on my phone,
Right,
so it's harder to see it.
Right. Okay, sounds good. So as I see things, I'll just we'll pause every so often, and I'll let you know. So
Okay.
when we aired the show coming today, there was a lot of questions coming in about just being nervous about the vaccine. What is in it? Was it developed very quickly in a rush in the last few months? Or I heard that there was kind of a shell for it already, like it had been in process. But I didn't really understand it. And I said, well, I'm going to ask Dr. Wu when she comes.
Okay, so there's a lot of questions in that one question you posed. So let me just start by, I know you hosted Dr. Bela Matias, our health officer, last November, and that was when we first entered the purple tier, right? And that was when we were seeing effects from gathering from the Halloween, and we were having a surge. Now in December, we actually started to see the Thanksgiving gatherings surges, or number of cases increase from the gatherings that occurred over Thanksgiving. But what was good about that what was good about December was that we, at the same time, we got notice from the Federal Food and Drug Administration that they gave the emergency use authorization to the Pfizer vaccine, and then shortly after to the Moderna vaccine. And so what that means is that we get to start vaccinating people. And this also means that we really get to start taking control of the level of immunity in the community that's needed to stop this disease from spreading. And so you asked, is the vaccine safe, right? So I'd say it's definitely safe. I'd like to first say that the purpose of the EUA that I mentioned, the emergency use authorization, is to make available medical measures such as testing mechanisms, medications, and even vaccines available for use in emergency situations such as we've encountered with the COVID-19 pandemic. This does not mean that they get to cut corners, though, and that this vaccine had to demonstrate to all these different independent auditing committees that it is safe in people before it can be given that EUA, or the emergency use authorization. But what the government did to facilitate this process, to make it much, much faster than usual, is that first of all, they started this process early. So we knew, as you saw, we actually knew about this disease earlier than the general public did. And, at that time, the government developed a public-private partnership to accelerate the development, manufacturing, and distribution of any COVID-19 vaccines at the time. The scientists who were tasked with this also got to build upon prior research and understanding of vaccines, because vaccine development didn't start this past year, right? And one of the main scientists at the National Institutes of Health, who ultimately helped develop one of the vaccines that was approved, the Moderna vaccine, had been researching vaccines on coronaviruses for the past 6 years. This is the SARS-CoV-2 is the virus that we're talking about. That means there's a SARS-CoV-1, and that occurred with the SARS epidemic and pandemic that in 2003. And that scientist actually happens to be a Black woman, Dr. Kizzmekia Corbett.
We've
And if
heard
you,
that.
yeah. So
Let's
if you
say
want
her
to
name
look her
again.
up, Kizzmekia, Kizzmekia Corbett. She's an excellent speaker and has a lot of good information online that I really enjoyed learning about. So anyhow, the government put tons of money, like $28 billion, if not more, into the development of this vaccine. And, prior to the COVID vaccine development, there really wasn't much money in vaccine development. And so it was a really slow process. But with all this money put in, it means that, people really were going to be hired. Multiple people were hired to work on this around the clock. Companies are going to compete with each other to try to be the first to create this safe and effective vaccine. And on top of that, they didn't get to cut corners. Like both of these companies enrolled tens of thousands of people in these clinical trials, in all three phases of the clinical trials, to look at safety and then effectiveness of the vaccine. And they even were able to enroll ethnic minorities into these safety trials. And then also the other thing I wanted to point out, that why it was so fast is that when you try to develop a vaccine in this middle of a pandemic, it actually helps speed things up a tiny bit, or maybe even a lot, because what happens is for the safety trials to work, you have to compare the group that gets the vaccine versus the group that doesn't get the vaccine. Now, if you have a very rare disease, it's hard to get someone to be exposed and then to develop the disease in either group. In this case, because we're in the middle of a pandemic, there's a lot of exposures and a lot of people developing disease. And so this helped the companies that were trying to figure out whether or not a vaccine would work to protect someone, find out the answer a lot faster. So you also asked, I think, a question about whether or not this the science behind the vaccines had previously been developed. So I also want to say, there's different types of vaccines, but these first two vaccines uses a special new technology for vaccines. It's a mRNA vaccine, meaning it's a messenger RNA vaccine. And the knowledge and research behind the mRNA vaccine actually has been in development for over 10 years. Research behind the mRNA is a part of a genetic material. It's a type of genetic material, but it's not DNA. It actually is something that tells the body. It's basically like a recipe or instructions for your body to make something, usually a protein. And so what this one does is it tells the body to make a protein, a spike protein that's on the outside of the SARS-CoV-2 virus. And then it sort of tells our body how to make the antibody that of this potential infection that you can get. And the person who developed this, she was a Hungarian-born scientist named Katalin Karikó, and she actually made breakthroughs in this kind of technology in 2005, and then again in 2015 on how to get this mRNA particle into a cell. And so, and ironically, at one point her research couldn't get funded. Like I was saying, funding is key to how quickly the vaccines can get developed. And I already mentioned, Dr. Kizzmekia Corbett, who had been researching vaccines on other viruses, including the first SARS coronavirus. And she had been working on this for at least 6 years with the government before Operation Warp Speed went into effect in May of this past year.
What's kind of cool is that it almost feels like a women's empowerment talk.
Yes, I totally agree.
It's heartwarming to hear that we have these amazing women scientists that are doing this work, and that you were right there in the front lines in January, and you belong to us. You belong to us in Solano County. So that's pretty amazing. So are there So there's two different companies that are providing the vaccine. Is it the exact same formula, or is one formula better than the other? How does that work?
So I like to say, and you may have heard other people, other doctors say this, public health officials say this, the most effective vaccine is the one that you get in your arm, so they're both the same type of vaccine. Like I said, they are both messenger RNA vaccines or mRNA vaccines. So they use the same basic technology to get these instructions into your body. To start to get your body to ramp up the antibody production. There are other vaccines that you may have heard about that use like a virus to get to simulate an infection so that your body will ramp up production of antibodies. There's two companies. The Pfizer vaccine is the first one that got approval. The second one is the Moderna vaccine that Dr. Kazmiekia Corbett worked on. And they're both equally, from what it looked like, equally, they both enrolled 30 and 45,000 people in the phase 3 trials and were able to show safety and effect in everyone enrolled, and including elderly people over 65 and over 75 in both studies. So I really feel like, this is if you are given the opportunity to be once it's your turn, that that's what you should do, is go and get vaccinated. You don't need to ask which one it is, because the Pfizer vaccine does require it to be kept frozen, and so it's a little bit harder to transport to when we need to go out to vaccinate the community.
Well, that brings up one of the questions in the thread. It's asking specifically about the Pfizer vaccine. Why does it have to be stored in sub-zero temperature?
So, I think I can't speak for how these vaccines were developed, but the way we tested it was that this one, it seems to be more fragile and requires that it to be stored at negative 70 degrees Celsius. So that's a very, very cold freezer. And there's protocols for how long it can be out after you thaw it, and within what time frame after it's at room temperature that you can use it. And so because of those limitations, we've mainly been using them close to the site where they're stored at the acute care hospitals. And I actually really want to give a shout out to our amazing hospital partners, Kaiser, North Bay, and Sutter, who really have stepped up right from the beginning of this vaccination, and actually at the beginning of this pandemic, in helping our county specifically with when we had the repatriation flights, but now with the vaccinations of all the different priority groups. They've really gone above and beyond. And now they're vaccinating even people who aren't members or their patients. So
that's commendable. That's commendable. Let's see what other questions. I see Robin Walker. Hi, Robin. And she wants to thank you. This information is so informative. And there's a question from Mary Ellen, and only some of it is showing. So let me read it. Mary Ellen Jones says, over 20 million vaccines have been shipped all over the country. Less than 5 million have been administered. Are there remaining vaccines still viable?
So yes, and the companies are still, producing these vaccines at this time and shipping them. So if you are to go on the California Department of Public Health vaccine website, they're going to be revamping that as well to make it even better and more informative. It'll show the distribution and the numbers of vaccinations that have been administered thus far. As I went there last night to take a look in preparation for this so that I can tell you what I saw. But as of yesterday, or Sunday actually was the last time that was updated, in California, we have administered 783,476 doses of vaccine out of the 2.9 million doses shipped to local health departments and multi-county entities or hospital systems. Our region, which is Region 2, it includes all the Bay Area and some of the slightly north and slightly south counties near the coast, administered nearly 200,000 doses, and really have ramped up our ability to get these vaccines into people's arms. Like I said, in Solano, in the last count I got from late last week, we've actually given close to 15,000 doses. So we're trying to get people vaccinated as quickly as possible. I want to just say a little bit something about how we're getting vaccines out to people. So first of all, the vaccine is free. There's no cost to people to get the vaccine. And our goal for the distribution of the vaccine really is to ensure immunity to the whole community, because that's how we can protect people, right? Mm-hmm. And because we're still ramping up production initially, there is a limited supply, and the whole country, is getting supplies. The federal government, the CDC, and our state health department, along with community input, both federal, nationally, statewide, and locally, really have given input to determine the importance of protecting those who are at most risk for being exposed to the virus, such as our hospital workforce, and to protect that workforce so that they can take care of the whole community, but also to those at highest risk for having the worst outcomes from getting coronavirus. So like the elderly or people who live in congregate facilities. And so those are in the phase 1A, tier 1 and 2 priority groups. I did send a link to the distribution priorities listed on our site. So thank you for pulling that up. I can see that. Yeah, I can only see half the screen, just so you know.
Oh no!
But that's let me. That's okay.
Yeah,
I have a physical copy somewhere. So let me.
Oh, okay. Oh, good. And in the meantime, I'll if I can't make it bigger. But it is
let me
showing.
just grab my. Yeah. So other people, which is the most important. Everyone else can take a look on their own. Okay. So let me pull it up on my own computer. That'll help. So I can just go over very quickly.
Right. And for everyone watching, we just posted the link on the stream, so you can click on it.
Perfect. So if you look at this, we've been vaccinating in phase 1A, tier 1 and tier 2, which covers all the acute care hospital staff. You may have heard about why we went into this. Was actually ICU capacity actually has been changing because of the numbers of cases that we're getting, right? And so when a region, the Bay Area region, dropped below 15% ICU capacity, then we have to go into this new stay-at-home order past that purple tier. So it's so important to protect that hospital acute care workforce. And so if you look, that's who is prioritized in phase 1A, tier 1. And then the other, if you want, I can read through it very quickly. There's the ICU, emergency room hospital staff. There's the COVID-19 unit hospital staff. All the other, acute care surge staff, meaning, if someone calls out sick, they have backup staff available to come and help with staffing those ICUs and ERs, right? And then the people who are giving vaccinations, we want to make sure that they are also protected when they're and not potentially spreading illness to people who don't have the illness. And then we also want to protect the skilled nursing facility and long-term care facility staff and residents, dialysis center staff, and then the inpatient psychiatric facility staff, because they've had many outbreaks as well. And then the tier 2 are home health and in-home support services, caregivers, first responders, primary care providers, medical ancillary support staff, intermediate care facilities. And the next group to get the vaccine will be the tier 3 of the phase 1A group, currently highlighted in yellow. And those would be the specialty clinics, our public health laboratory or other laboratory workers who regularly work with coronavirus specimens, our dentists and oral health care providers, other pharmacists that may not have already gotten vaccinated. And then we'll move on to people over age 75 and over, and vaccinate our educators, and then people who work in other essential industries such as food and agriculture in the phase 1B tier 1, and then phase 1B tier 2. There's the other people who are elderly, 65 and up, and in other congregate settings, the homeless. There's a whole list here. I won't go through it all because you can go on the website yourself and take a look. We do try to update this on a daily basis, but sometimes, there just is no new information. And so if you're interested in getting vaccinated, which I highly recommend that when it's your turn that you do, this is the best way for you to protect yourself and protect your family when it's your turn if you're in a priority group. But once we pass all the priority group and the vaccine is widely available, we're going to be able to start vaccinating the community. That's when you can go to your healthcare provider or your medical home and get vaccinated that way.
So it looks like, just going through the list, it looks like it's moving very fast.
Yes, we're moving through it very quickly, and that's why I shouted out those 3 hospital systems, because how most times people have to go to their doctors to get vaccinated. It is a free vaccine, right? But they stepped up and they're vaccinating people left and right that aren't necessarily Kaiser patients or North Bay patients, and so I just find that so amazing that these hospitals have done that, and they're moving through it so quickly. And we've trained our public health staff to go and assist with this process as well. And we also have partnered with our EMTs with medic ambulances, and they're going out to help us vaccinate the memory cares and assisted living facilities. CVS and Walgreens have partnered with the state to help our skilled nursing facilities and nursing homes vaccinate their staff and residents. So there's all these multi-agencies and multiple partners here working together, and I think that's what's so special about Solano is our close relationships and how we help each other.
I agree. The vaccine, and this might be listed under fact or fiction.
Okay.
Is it true that if you have heart problems, this isn't a good vaccine? The vaccine is not a good option for you?
On the contrary, actually, if you have hypertension or other heart problems, you should it puts you at higher risk for getting coronavirus and having a bad outcome from coronavirus, this coronavirus, the COVID-19 disease. And so people who have chronic illnesses should be vaccinated. This vaccine, their only contraindication is for people who have severe allergic reactions, like an anaphylactic reaction, meaning that their throat closes up or something, to a substance in the vaccine called PEG or polyethylene glycol, which some people have allergies to. And if you've ever had an allergic reaction to this substance, you should inform your provider and talk with them about it before you get the vaccine. But it's a very rare allergy. So for most people, this should not be a problem.
Very good. And should we, it seems like it's good that this ramps up fast, because I'm hearing that there's a second strand. Does that impact vaccine distribution, or is this under fact or fiction again?
So yes, the SARS-CoV-2 virus is a RNA virus, right? So this type of virus, the nature of viruses actually is that they mutate rapidly. They're mutating all the time. The influenza virus mutates every year, and that's why we have to get vaccinated with a different vaccine every year. We're hoping that's not the case with this SARS coronavirus, but it does mutate, and most of the time the mutations really don't make any difference at all. Once in a while, some of these mutations can have a functional effect on how this virus works. And what you've heard is that, or what everyone's been talking about, is this new strain coming out of the United Kingdom, the UK variant, which has several mutations on it, one of which has shown it to be able to replicate faster once it infects someone. And so that causes the viral load in a person to increase to make it be more transmissible, meaning that a person who has more of the virus is able to infect. However, wondering if that affects this vaccine that has instructions to tell your body how to make a specific protein called a spike protein that's on the outs that describes what this virus looks like on the outside. And so that part of the has not changed with these mutations. And so the vaccine that you get will still be effective for these variants that are coming out. Now, we do probably need to be very careful and monitor this carefully and make sure that the new variants don't affect future, how this vaccine works in the future.
So, there's in the Black community, and it could be other ethnic groups too, but we're very weary of, being getting vaccine, having this vaccination. What do you say to ethnic groups that have, that are weary, that are worried?
Yes. Yeah. So, I understand that there really is longstanding mistrust and fears in all our ethnic communities and minority groups. And we have to acknowledge that. In Solano, we have seen these health disparities, higher rates of COVID, like I said, and negative outcomes in our Asian Pacific Islander group, our Black and African American populations, and the Hispanic Latinx community. And this is actually mirrored across the state and the US. What we need to do is really build confidence in our non-white communities. I think the message that this vaccine is safe is so important to say, but just as important really is the person that's saying it. People tend to trust those who they know, right? So they trust their own doctors, they trust their pastor, they trust their community leaders. And so what we're doing in Solano and in several of the counties around us is, we're working specifically in Solano, we're working with our community intermediaries to make sure that this message is loud and clear, that these vaccines are safe for you and for me. And I really see this as an opportunity to build trust, to start to build that trust in these communities and start to make right the wrongs that history has shown us to have done. We want to ensure that these communities know that the vaccine will protect them, will protect their families, and hope that this allows us to have a chance to turn around those health disparities that we've been trying to address in the public health for so long.
Is there a way to, as as you all are touching all of these communities and starting these conversations through this vaccine, is there a way to close up the disparity in general in the health center, almost in the health system, almost kind of a 2-for-1?
That's what I hope, right? It's very hard. I mean, these are long-standing structural, that you're describing, that you're referring to. I think for the Black community, there's the Tuskegee, the history there on human experimentation. I do want to say that out of things like that came new protections and new regulations, though, that really have prevented things from ever happening again. And so now the research on human subjects are just much more rigorous and protective of human lives, and that's why it actually takes a lot longer to conduct research scenes if a pandemic. That's how the emergency use authorization actually help increase the speed of specific things like the vaccine development.
Is there a way for people that have health risks to kind of bump the list? Diabetic, bump the list. Is there?
They're actually prioritized in phase 1C as people 16 to 64 years of age with underlying health conditions. Also, we know that the older you are, the higher your risk of having these chronic conditions and chronic health conditions that put you at higher risk. And so there's an age prioritization as well. As you saw, we're next going to be vaccinating people 75 and over. And then in phase 1B tier 2, also those 65 and up. And then in 1C, we go down another 10 years to ages 50 and up. And then those in the general adult population that have underlying health conditions. So they are prioritized.
Got it. And I think we just have 2 more questions. There's a question from Lisa. She says, if someone takes care of their parents, their elderly parents, but they're under 65, could they get the vaccine? Because it's more questions about, specific instances that seem to warrant a bump in the list.
Yes. Yeah, I can tell that actually, makes me feel really good that people really want to get the vaccine, right? Because the whole goal is to have everyone vaccinated eventually. The thing is, if you are the primary caregiver for your elderly parent and they are very sick and it's their turn, now because of the scarcity of the resource, we want to make sure that your parent is prioritized to be vaccinated. Once they're protected, it shouldn't affect whether or not you affect them. And so we're not able to vaccinate people who aren't in those priority groups pretty soon, right? We're going through this very quickly, and so I really hope that you go and get vaccinated.
I like this next question too. It came in through LinkedIn from Wonderful. And she says, does the medical profession take a different shot from regular people?
No, they're the same. I keep on getting these messages. I wasn't able to turn off my, the automatic. Sorry, so I can't see there.
Oh,
okay.
No.
No. So there are only there are only 2 approved vaccines in the US, not approved, but 2 vaccines that got their emergency use authorization, and that we're giving out to anyone, to everyone. So there's no difference.
Okay. And is there a difference between, because another question that we got during the week was the ask about, the administration, did they get a different, the president, did they get a different set of vaccines than we're getting too? So that's out there as well.
No, not at all. And FDA is able to vaccine that the company releases, right? That same vaccine is the one that's been given to Dr. Jerome Adams, the Surgeon General for the United States, Dr. Fauci, and our lawyers here, our respiratory therapists, our ICU nurses, our EMTs, so it's not any different.
I appreciate you just letting us just fire away with all these questions that we just had in our heart to ask, they and to answer them so thoroughly. I just appreciate you. I think this is going to help the community get more comfortable. Well, any final words? I think this has been, we're already, how did that go so fast? We're already at the top of the hour. And I want you to know that you have a space here with us. If there's information that you would like to get out, I want you to just let us know and come back. We want to be a resource for you.
Very good. I just, in closing, want to say, just reiterate this message. I see this as a way out of this. To our school, easy to get. We're still months away from vaccine out to everyone's to be vaccinated, but that possibility is there. I have to tell you a secret. So my name in Chinese, my mom gave me my name in Chinese, which means rainbow. And that's how I like to see things, we've been in like a rainstorm for so many months. This vaccine is like a ray of sunshine that will create a rainbow to guide it to the golden treasure at the end. So this is really like light at the end of the tunnel. So if you get that chance to go out to get vaccinated, protect yourself, protect your family, please do so.
You were named perfectly. I love it. Just so you know, Wonderful Davidson said, wonderful, wonderful. Thank you. Thank you for your information. Tanya Alston says, thank you for sharing this important information. The more I hear from respected health professionals, the more comfortable I am with my dad getting the vaccine and taking it when it's time. So thank you. This means, oh, Lisa says you're a beautiful rainbow. Thank you, Dr. Wu.
Thank you so much.
I don't know if it any better than that. That is wonderful. Well, I'm going to put you in the waiting room and I'm going to close out the show. And don't go anywhere, okay?
Thank you.
That was a great show. That was the show I literally have been waiting for since December. I feel more comfortable and I'm going to get the vaccine and I believe I'm going to do it on camera. So we need to stay safe. I feel comfortable. Let's stay safe. Let's keep our family safe. Let's keep our community safe. Let's wear our masks. Let's do what we're supposed to. This has been an amazing show. And thank you. This is Turning Point with Patrice Williams. Hold on. I'm going to show you our outro.
Thank you for listening to another episode of Turning Point with K. Patrice Williams.
Something better is always possible if you're willing to work for it and fight for it.
Don't forget to subscribe, like, and leave a comment. And never miss a podcast or live stream by visiting our website, imkpatrice.com, or connecting through social media at IamKPatrice on all platforms.